You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Sean Wilkie, and along with my awesome co host, we interview the innovators in this space every week. Ivan, go ahead and get us started.
Yeah, I'm Ivan Zach, and I'm excited to have a repeat guest, Dr. Sarah Machell, with a different company, with the company PetPath. Dr. Sarah is graduate of Ontario Veterinary College and previously owned and operated small practice in Ontario for 18 years. Since transitioning her practice in 2019, she has worked in a variety of industry spaces with a special interest in technology and virtual care. Sarah is passionate about maximizing the capacity of veterinary practices to engage with and effectively leverage technologies to improve practice efficiencies, patient outcomes, and career satisfaction. One of Sarah's current roles is the medical director for PetPath, a digital tool that provides critical bridge between inpatient and outpatient care for both practices and pet owners. Sarah, welcome to the show. Thank you for finding the time.
Thank you for having me.
PetPath. So this is a new gig. So you were with Vetster before,
Correct.
and then now you're back with this. So what is PetPath? What do you guys do, and what is the value proposition for the customers?
At PetPath, we are a mobile phone application that essentially takes a veterinarian or a practice's written discharge instructions that generally are stored in a PDF format, shared with a client at discharge, post-surgery or post-diagnosis, and either in a written format or emailed to a client. We take that content and we digitize it and put it into our app, and then we deliver it to the pet owner through the app, through daily task-oriented, video-heavy, image-heavy, interactive content to help support them once they've left the veterinary practice with their pet in their pet's recovery through whatever the diagnosis or the procedure was.
So how do you digitize it? Just what's the process like? We have a PDF, and then just walk us through, because we're a podcast. So what's that visual like? I'm a veterinarian and I have my discharge instructions usually kind of canned for different conditions. And then what does the veterinarian do that is different from what they're doing now? And what is the format that, what do I do physically? Do I send an email? Do I just upload this form? And then how does that convert into the discharge instructions for the owner? And what do they see? Is it app? Like, what is it? What is the interface like?
So the pet owner at discharge or at release from an appointment following a diagnosis, the pet owner is supported to download the mobile phone application from App Store or Google Play Store onto their smartphone by the veterinary staff. And then what happens is we take your practice discharge information, as you said, copy heavy, and we break it down into small, daily, digestible formats that get pushed through the mobile phone app to the pet owner. And then it's interactive and almost gamified types of daily tasks for them to complete and check off and then move on to their next day, their next step in the pet's recovery. What we have done is we've taken your canned discharge information and we've translated it into ensuring that the readability is accurate, and basic, because most of us as veterinarians think that we are writing client-friendly materials, but actually it's generally written at a much higher reading level than is sort of broadly acceptable. So we take that information, we modify it and translate it, and then we also add images, and we also get in front of the conversations particularly with images or videos that most commonly crop up when you discharge a patient from a particular procedure. So for example, let's take a TPLO, very common orthopedic procedure. We all know common things are common even in the discharged patient. And so one of the things that we do is we provide a daily incision check for the first 5 days. That's one of the tasks. We provide the pet owner images of what a normal incision, bruising, swelling, all of these things can look like, as well as images that if your pet's incision looks like this, then it's a concern that you need to reach out to your pet owner, your veterinary provider. And so by getting in front of those conversations, we help to improve practice efficiencies and reduce sort of the burden of care of the discharged patient on the practice staff, but we also dramatically improve client engagement and client satisfaction because they feel like they're being supported by their veterinary team, even though their veterinary team is hands off and doing what they need to do, taking care of the patients in front of them. And so in exploring the satisfaction levels with our pet owners on the use of the app, these are sort of the two biggest highest rating things. 90% of pet owners who use the app feel far more comfortable and confident in taking care of their discharged pet, and 80% of them feel that it's intervened and prevented them from needing to reach out to their veterinary team. So they feel empowered and engaged and a part of the recovery of their pet.
Some pretty good stats there, Sarah. Pretty impressive. Quick question for you. How did this company get kicked off? What's the origin story, and then how did you get involved?
So our origin story is that one of our co-founders experienced a very serious accident on his bicycle, and he himself went through a pretty challenging, extended, protracted human health recovery experience. And during that, he sort of had a light bulb moment where he said, there's got to be a better way than just Googling everything and feeling so alone. And so he actually created a human application called My Health Track, which is very much the same, working with human physios, surgeons, etc., to help support those patients. And ironically, his neighbor is a veterinary neurosurgeon in California who heard about or had a discussion with him about what he was doing, who said, hey, I think we need this in veterinary medicine. And so Dr. Robin Latinsky got involved. She sort of got behind this idea, got the ball rolling with the other co-founders to kind of get the veterinary track going. I met up with these folks at an event at the end of 2021 and was really intrigued by what they're doing. I love the idea of supporting those pet owners. And then when I found myself in a situation where they were looking for some veterinary oversight and I was looking for something else to support myself and get involved, and I joined their team just over a year ago in January. But the actual company itself got started about 2.5 years ago.
That's great. Really amazing. So the one question that came in the back of my head just as I was quickly looking at you guys' website before we started recording is there is an element of live interactivity with the pet or with the hospital. So there's got to be some connection there. And then the thing that I wanted to kind of explore with you a little bit further is, there's all kinds of client communication apps that do a portion of what I think PetPath does. But what sets PetPath apart from other kind of client communication apps? Where do you guys, what's special about PetPath that maybe is unique?
So great questions. So what I wanted to say is that we do offer that as an option. So on the back end of the platform for the practices, should they wish to be able to communicate with the pet owner through the application, we do have an asynchronous chat function, but that's something that can be toggled on or toggled off at the practice's request, because some practices don't want another avenue to have to stay on top of client communications, asynchronous communications. And some practices do, and so that's an easy toggle on or toggle off. We are different such that we have really specialized recovery paths and really detailed and in-depth visuals and video libraries specific to each procedure. So, for example, we have it's customizable for each individual veterinarian so it can have their own content. It's not just a client communication tool, it's a client education and empowerment tool. And so when it comes to a TPLO procedure, we have daily interactive content for up to 8 to 12 weeks, depending on the practice's preference. And so it's not just an appointment reminder tool, it's all of this knowledge about even pre-operatively, for example, how to set up their pet's recovery space at home, and reminders about how how the pet is going to be recovering, how to be able to do passive range of motion procedures at home. And so it's just it's a very different type of tool. It's not just a communication tool.
Yeah, that makes perfect sense. I totally get it. Maybe a dumb question, but you said the pet parent is the customer, or is the veterinary hospital the customer?
So ultimately, the pet owner, the pet parent, is the consumer of
Yep,
the application, but the veterinary hospital offers this service to their clients.
got it. So they're the customer. They're
So
the
they
people
are
that.
so they are our customers. Yes. Yeah.
And then the last question, and sorry, Ivan, I'll give you a turn, I promise. The last question I have is like, it's a journey to get people to download an app, and it's one that me and Ivan are pretty familiar with, having
Yep.
tried to do that for many, many years. What's the benefit besides the obvious for the client to download the app? We already know that there's the daily instructions, but the procedure's over. Is this app still on their phone? And what's happening, on the other side, week 18 of the procedure that doesn't have any updates anymore? How are you guys monetizing the after procedure fact that you're still on these phones?
So in terms of the monetization of it, there's a couple of aspects to go down that with that, Sean. Um, First and foremost, it works on a pay per use to the client, um, to the practice. And so the practice, we take the practice information, there's a fee for customizing their particular discharge procedures. And then as their clients download the app and travel down a recovery path, they get charged per client per path. And so they can actually monetize that and use that as a revenue generation source rather than all that time in the practice spent supporting those patients that we don't get any money for, or we don't see any revenue for. And then from a pet owner's perspective, I think the value prop for the pet owner is this fact that they feel that peace of mind. And so they enjoy, and if gamifying is done really well on an application, then they look forward to the next task and the next achievement. And then seeing their pet recovering and knowing that they're following all of those, standard guidelines of recovery that we provide. By week 12, your pet should be walking like this, should be doing these types of things. And we can also embed content that asks for feedback from the client into the app. Again, if the practice wants that. And that once more helps to make that client feel very special. It's white glove elevated discharge care, right? It's that type of wow service. And truthfully, the pet owning demographic, the millennial generations, we don't want to harp on those, on those folks, but this is the kind of thing that they're looking for, services that go above and beyond.
Yeah, it makes tons of sense.
Yeah, I want to go back to sort of the value proposition to veterinarians because I can see tremendous value to the customer. But as you are reaching out to the vets, I think it's a fantastic idea. But do I feel if it's fantastic enough to pay for? That's the struggle usually that businesses
Mhm.
have with because it's, is it the must have, want to have, or the dream? I always ask that question amongst the staff in my hospitals and say, is it a must have that you're ordering right now? Is it a want to have, or is it the dream? And
Mhm.
is there a particular customer? So if someone is listening right now, because broadly you can say, well, it's for any hospital. If you discharge patients, that's for you. And that would be true.
Yeah.
But is there a
Yeah.
particular customer that you're after that you really would recommend them to check out this product and say, hey, if you are an orthopedic surgeon, that's sort of a must have for you because the recovery and the compliance is the success as a part of the success. So, and that would be sort of what are those niches amongst the veterinarians that truly should look into it?
I think you nailed it right on the head, Ivan. From the gate, our ideal customer at this point in our company sort of trajectory are the specialty hospitals, the surgeons, neurosurgeries. We're also working with some cardiology departments and dentists as well, because these are the types of procedures and diagnoses that tend to follow very common paths. And so you can have your very scripted, very canned recovery that 85 to 95% of your patients are going to fall in that path that's nice and streamlined. And so the value prop really for for those types of individuals and those types of practices is exactly the things I spoke to when we first started talking. First of all, it's really bonding that client to that service and that practice, and having them engaged in the recovery, and then coming back, you know, as a raving fan, not to quote an old business book, but and it's also it's reducing the workload and that redundancy, particularly in any hospitals at this point in the game. Technicians and support staff are some of our most challenging. They're worked off their feet, you know, and they don't have the capacity to be doing that kind of white glove, elevated taking care of those patients once they've left the building. And so when we were talking about collecting data earlier, we've also taken some data from our practices that we're partnered with, and the practices that we surveyed report a 76% reduction in the number of clients seeking additional support once the patient has left the hospital. So that being phone calls, text, after hours support, email, all those types of things. And also a 74% reduction in the amount of time needed to support these clients. So that's a pretty tangible value back, if you ask me. That's adding a staff member to your team to take care of those clients once they've walked out the door without adding them to your payroll.
Well, and I think the thing that you've really done a great job of articulating is your customers are right now not getting paid for those things. And so what you're trying to do is flip the industry and say, turn this information into a revenue source, pay us some money, and all of that time that you were donating, we're going to give you 76% of it back. Exactly. That's pretty fascinating.
You know, that's 76% more time. So first of all, you're actually generating revenue on a service that you've been giving away. And then you're also finding 3/4 more time to be able to focus on other revenue generating things on the patients in front of you in the hospital.
It's a pretty interesting idea, and we're out of time, like we often are on the show. Thanks for joining us. We got a couple of questions to wrap up, and you probably know what they are because they've been the same for about 4.5 years. But the questions we've got for you before we wrap up is a book, a YouTube video, a TED Talk, something that you found interesting or inspiring on your path so far.
Well, I think I mentioned it. You asked me before I came, but I love the premise or the theory about the jobs to be done by Clay Christensen. Really digging in and looking at people are buying something or wanting something. What is that thing doing for them? And how do we put that in front of them in the place when they need it and they're looking for it? So I really love that theory. It's an oldie but a goodie.
And that's in the Innovator's Dilemma, isn't it?
Yes.
Yeah.
Yes.
Love that book. And Clay Christensen, just a genius
Yes.
man.
Yeah.
And the second question that we ask, is there another innovator that you have in mind that this show would benefit from having as a guest?
Of course, yes. I'm a big fan, a raving fan of Dr. Jill Clark from Ignite Veterinary Solutions. I think she'd be a great guest on your show.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryinnovationpodcast.com. See you next week.